At the age of 21, my health was really good. I was a competitive athlete all my life. I was away at University of Waterloo doing my undergraduate degree, and I went to the gym with my best friend on my 21st birthday. And before we started working out, I started getting some numbness in my left side, kind of like migraines I've typically had. This numbness wasn't subsiding, so I said, forget the workout, let's just go. As we were leaving the gym, I collapsed, had a big seizure, and was rushed to hospital, and did not see the stroke coming whatsoever. It has been 7 years since my stroke. Sometimes the changes aren't as noticeable. You have to kind of chip away at your recovery, but I'm living proof that the brain is plastic, and it's very hopeful to me to hear that they might be able to repair the damaged cells in my brain, and one day I might get the use back in my hands. It would be so life-changing.
Plasticity really refers to adaptive change. It can be in response to anything. It can be in response to learning. It also occurs quite dramatically when we have brain injury, like stroke or some other type of brain insult. Existing brain pathways that are damaged, the ones that survive will sprout and form new connections and fill in the spaces left by the damaged or dying connections. By studying these processes, we can harness them by engaging in novel types of rehabilitation to boost what goes on naturally in the brain in response to injury, and we think lead to much better stroke recovery.
I had what the doctors described as a massive right brain stroke, so my left side was paralyzed. I had my stroke in September 2003. I was 59. 2.5 years after my stroke, I began to walk with the cane. And now I'm doing a lot better.
Claire engages in wheelchair curling and also a lot of cultural activities.
This is my magic stick.
Now, the wheelchair curling is a nice example of what I would call adapted exercise, because she's adapted a type of exercise for her disability. She's not limiting it and say, I can no longer curl. She said, okay, how can I do this activity that I really enjoy? So she's done that and is able to engage in physical activity that will help her with her stroke recovery.
I do go to the theater, and I take a subscription to the French Theater at the National Arts Center every year.
The socialization is also really important for promoting cognitive recovery in middle-aged individuals.
When I had my stroke, my mini stroke, TIA, it was in 2 years ago. I'm 82 now, and that was my 80th birthday present. I had a horrible headache, and I just felt so tired. I felt like all my insides had been taken out of me. Dr. Swartz asked me if I would be willing to go to the rehab center.
And then we're going to hit start. Okay.
So someone like Helen, who's had a stroke late in life, in her case it was a TIA, by engaging in exercise, she's able to help protect herself from having a subsequent stroke, which would probably be a much more severe, damaging stroke. It also enhances many of the plasticity processes that we know to be important for cognitive function and for good motor function as well.
My students used to say I was a walking thesaurus. And all of a sudden, I discovered that although I knew the word existed, I couldn't pull the right word out of my head. And in the end, I was forced to actually resort to a thesaurus, either online or in a book. And that was the beginning of it.
So if you have a covert stroke, it often leads to cognitive impairment, very often in sort of higher planning, what we call executive function.
It didn't really bother my life that much until after I'd retired, and it became very much worse, so that I would freeze up in the middle of a conversation because I couldn't think of the word or phrase. And then I started doing things like losing my keys more often, losing my wallet more often, not remembering where I'd parked the car more often.
With goal management training, Deirdre is now able to resume a much more normal life. The training breaks down the activities into simpler components and lets them to reestablish these things that they were unable to do as a result of this disease.
It just showed you that you can train your brain like you can train your muscles.
Deidre was able to adopt goal management training and was able to perform really quite well in many of her daily living activities.
Being an athlete all my life, my worst fear is paralysis, and there I was living it every day being in a wheelchair. That really inspired me all the more to want to get out of it faster and work really hard.
For someone who's young and has had a stroke, they have the potential to benefit from a lot of the research going on in the Center for Stroke Recovery, because they have more time to really take advantages of the advances that we're making. One case would be with our neurogenesis research, the formation of new brain cells. When you introduce a brain injury, these cells can be encouraged to migrate towards the site of injury and maybe repopulate the area, or at least be a source of factors that can enhance the plasticity of the surviving tissue and ultimately lead to a restoration of function.
It's been kind of trial and error in terms of finding out what I can and can no longer do. I've done hip-hop class, Zumba for fitness, and by no stretch of imagination am I wonderful at these things, but it gets me moving around and I have fun and I just try my best.
Because she's young, because her brain is young, it can take advantage of many of the plasticity processes that we're trying to tap into through our research in the Center for Stroke Recovery. So I'm hoping that she'll continue to make even greater strides as we learn more through our research in the future. So as you can see from the stroke patients that we study and we try to help in their center, they range in age from a very young person like Stephanie, who had her stroke in her 20s, to someone who's elderly in their 80s. And this is going to be an increasing problem, I think, as we go forward in the next decade or two, because one of the things that we've adopted in developed societies is increasingly a sedentary lifestyle, along with a diet high in fat, sugar, and sodium. So that's why we're constantly pursuing new approaches to see if we can raise the level of recovery to a higher level. We're never satisfied with the status quo.